be aware that anyone can get a burn at any time and anywhere if you are not careful.
We want the public to be able to gear at prevention, prevention, prevention.
I came to KNH after a high voltage electrocution accident. That was sometimes in April 2021, and it is one of the experiences that I can never forget.
We see two main groups of burns. One, children who are less than 5 years. They form almost 65%, 60 to 65% of patients we receive.
And these children are because of hot fluids that are preventables, like bathing waters, hot tea, hot soup, boiling githeri's, dengus. Then you find a child is dipping into that boiling stuff, and they sustain the burns that are very fatal if they don't meet people like us within the first 24 hours.
The second group are young adults who are between 20 and 40 years. That is the most productive, energetic group of people which we have around.
When the accident happened, some things changed. Right now, my left hand, as you can see, it is a bit disabled. I cannot use it effectively. My right hand, I can only use 4 out of 5 fingers. So my career was affected a bit because I need to use my both hands. But now I find that I'm doing other activities that do not require active use of both hands.
Most of them will be burnt by fires. At these fires, the majority will be either LPG, the gases, the cooking gas, leakages or fires from them. The second group will be electricity, electrical burns. People at construction sites, balconies have become very frequent. Open wires, either running over the roofs, from illegal connections, or even in the house where sockets are not properly maintained.
I came to realize a high voltage electrocution accident is not any other accident. Hii si kama ile accident ya gari ile unavunjika mguu. Hii ni kuchomeka umechomeka.
In terms of first aid, when a burn happens, in general it depends on the cause, but we shall say that if it is a fire, number one, if you are in a situation where there's a fire, the most important thing is to get to safety. So we say you should drop on the ground and roll and seek to get out of that environment. Dropping on the ground is because fire, being a hot flame, will rise fairly above the ground level. Then secondly, if you roll, then when you get in contact with the ground, you stop oxygen supply to the whatever is burning, so you are able to stop the fire yourself. If this person is near someone, they can be covered by a blanket, a jacket, something that can also block oxygen to the fire. Then the second thing is that if it is a burning cloth or something, it should be removed so that it's not in contact with the skin. Then once it is removed, if you have water around, cold water, for example, you can pour on the victim so that it cools the person who was burning. The victim should be covered in something warm so that they don't lose heat from the burnt area, and taken to the nearest health facility. We discourage people from applying anything at home, whether it is flour. People apply all sorts, flour, unga ya ugali, unga ya jogoo, unga ya kupika mandazi na kadhalika. So don't apply those. Colgate, cooking, some people use transformer oil, I don't know where they get it. So don't apply anything at home. Get to the nearest facility. For other burns like the children who get scalds, of course, removing them from whatever is burning them, whether it is soup or water, is the first step. Then cooling also comes in. Pour cold water on them, remove any dressing, clothing they may have on, or blanket, whatever is covering, because it will retain the heat that was in the fluid. So you remove it, cool them, then again cover them with something, clean blanket, clean sheet, clean lasso, and rush to the nearest health facility. So the message is, do not apply anything on the wound, on the burnt area at home, except covering it with a clean cloth or a clean sheet or a clean towel or a clean lasso, whatever it is, but don't apply anything else.
At one side is exciting and job satisfying, especially when you receive a critically ill patient who is not able to breathe for themselves, is not able to do any daily living activities for themselves, you are doing for them, and you see them walk home breathing on their own, feeding themselves. They are able to walk, they are able to use their hands to do their daily activities. That is job satisfying to us. On the other side, it's also sad when you see a patient, you've done all that needs to be done, and the patient leaves you. The patient passes on. And that's a sad moment for us.
I was in the burns unit for about 10 days, and I understand the burns unit is like, it's like the ICU for burns. So I was there for about 10 days. And when I became stable, I went now to the main ward, where I stayed for 101 days. And it was quite a long and painful journey. But I thank God I met a team of very nice doctors and supportive staff at KNH.
At the hospital, in terms of providing care, we are grateful that we are equipped both in terms of human skill and personnel. So we have doctors at various levels who are trained in treating burn patients. We also have nurses who have been trained and they work specifically for burn patients. Then we also have nutritionists. Because food is very important, it's like the main medicine for a burn patient, because the healing process will consume a lot of nutrients or food. Then we have counselors who have to talk to these patients, encourage them, even their relatives, because burns can be, if you get burnt in your face, it can be disfiguring, it can alter how you look, and you need a lot of psychological support for you to cope with that. So counselors are very important. Then we have people called occupational and physiotherapists who have to work with patients who have burns, for example, on the legs, on the hands, and they are not able to use them in the short term. So all this expertise is available in Kenyatta, both to attend to the patients and also to transfer this knowledge and skills to people who come from other institutions to train with us, so that when they go to those institutions, then we can expand this care outside KNH. Then the next thing is equipment and space. So we have a dedicated burns unit, which is like a critical care unit. Patients who have very severe burns, we will treat them here. In the critical care unit, when there's out of that critical phase, then we can take them to the general ward, which is also a separate place. But in addition to that, we are building even a bigger center, which shall serve as a national referral center and also a regional, probably for East and Central Africa region when it's complete. And so those are the things that we are looking at as a hospital for burn care. We are also grateful that we get a lot of budgetary support, because treating burns is very expensive. It's probably one of the most expensive conditions besides cancer that you will encounter in a hospital setting.
What I loved most is about attentiveness of my doctor. I was attended by two plastic surgeons, Dr. Kahoro and Dr. Nangole. And for instance, my left hand, this hand was supposed to be amputated. So they went an extra step of doing further research to make sure that I've retained my hand. It is because of them that I actually have my left hand today. And we worked with these doctors from surgery 1 to surgery 10. Cumulatively, I've undertaken 10 surgeries at Kenyatta in a span of 100 days, courtesy of these doctors. Dr. Kahoro, for instance, was so motherly, and she would go an extra mile of praying with me in the ward. So, and she would show me that these things happen to people, these burns happen to people, and what you need is the right mindset. And then you get up.
This week is very important to me as a nurse because it's going to reduce the workload. If we prevent the fires from happening, the number of admission will reduce, and will also help build the nation, because these people who are being hospitalized with burns, injuries, will be working out there. The children who are being admitted, they'll be in school. So it means a lot to me because we'll be able to save the future generation.
Our message to the public, number one, is prevention, prevention, prevention. So remember, you can, anyone, including me, we can get a burn. If you touch a hot iron box, it will burn you. If you are not careful with any source of fire, it can burn you. Even water, if you are going to bath, you slip and fall carrying it, it can burn you. So number one is always be aware that anybody, anyone can get a burn at any time and anywhere if you are not careful. So always be cautious anytime you are faced or confronted by a situation where there may be a source of a burn, either from a liquid or from an open flame. And in addition to this, that is why we'll be going out next week. We'll be visiting places in Mathare and some places in near Korogocho and Kariobangi. We are not able to visit everywhere in Nairobi, but these messages will also be out there on social media pages, hopefully also in TV stations and radio, as general information to the public. So when we go out, we just requesting you, these messages will come out through flyers, stickers, and all those, that you receive them positively and do what you can to reduce burn injuries in our country, because they are costly to treat and they can potentially be life-changing, particularly if they affect a critical part of your body like the hand, the legs, or the eyes. Those can alter what you do and how you function.
My message to the public out there: let us have alerts, eye alerts on the prevention of the fires. Prevention, 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 a million times.
I would like to thank the burns unit team. They tried their best to make sure that I'm healing well and I'm feeling comfortable. In as much as I was through pain, they tried their best. They went out of their way. And I want to encourage them and tell them whatever they are doing, it is not in vain.